Hello friends, my name is Roy Patankar. I'm a GI surgeon practicing in Chembur, which is northeast Mumbai at Zen Hospital. I've been practicing in Mumbai for the last 20 odd years in GI surgery, laparoscopic surgery and endoscopy. We're speaking on occasion of 12th of June, which is the World NASH Day. What is NASH? NASH or NAFLD is non-alcoholic fatty liver disease. It's a growing epidemic coursing across not only the Western world but many parts of Asia as well. So what is this NAFLD or NASH? The long form is non-alcoholic steatohepatitis. It basically means a swelling of the liver. We also call it NAFLD, which is non-alcoholic fatty liver disease. I think some of you will have had pre-employment checkups or corporate checkups where the ultrasound person tells you you have a fatty liver. And we often get perplexed about what this means. This basically means an excess deposition of fat within the liver and the consequent effects on the liver. So what are the common symptoms of NASH? Generally in the early days there are no symptoms at all. Often patients will have no symptoms and will have fatty liver diagnosed only on an ultrasound scan. What would you do if your ultrasound shows a fatty liver? Definitely get some tests done. We now believe that fatty liver or NASH is one of the leading causes of cirrhosis all over the world. It used to be alcohol, hepatitis B and hepatitis C, but we now recognize that NASH is one of the leading causes of cirrhosis, liver cell failure and even cancer of the liver in the later stages. So what should you do when your ultrasound shows a fatty liver? Definitely get your liver function test done. Get a lipid profile done, because this is often related to something called syndrome X, which is a metabolic syndrome where you have high levels of insulin resistance. What we are looking for is patients who have deranged lipid profiles with high triglycerides or cholesterol, high blood sugars, hypothyroids, or overlay of this is what is called syndrome X. And this is a big problem in India or in parts of South Asia. And we are genetically predisposed to this as compared to the West. If you look at Indian immigrants who live in the UK or the US, you will find that we have a centripetal obesity, which is definitely linked to increased cardiovascular risk, diabetes mellitus, and consequently syndrome X. So what tests are done? Apart from lipid profile, liver function test and thyroid profile, we will also do a fibroscan or a RFE scan of the liver. This actually measures the amount of fibrosis within the liver and can be a precursor to development of cirrhosis, liver cancers and subsequently liver damages. So what are the consequences of NASH? There is nothing like asymptomatic or healthy patients who have fatty liver. Eventually your liver function will get deranged. Long-term NASH could lead to cirrhosis of liver, which you know is irreversible with its necessary consequences. And there is a definitely higher incidence of liver cell failure and cirrhosis causing liver cancer in these patients. Whom should patients consult? Say your ultrasound is showing a fatty liver or your liver functions are deranged. You must obviously rule out other causes of deranged liver function such as alcohol, because we say this is non-alcoholic steatohepatitis. So necessarily this condition is only meant to be diagnosed in patients who don't consume alcohol at all. Second is screening for the common RNA and DNA viruses, which are hepatitis B and hepatitis C. So you must screen this out. If you are virus negative and you never consume alcohol, then we would call you NASH or NAFLD. So what would you do if you are diagnosed as NASH or fatty liver? First, you look at the liver enzymes. Do a RFE or a fibroscan to detect the amount of fibrosis in the liver. But most importantly, get off your backside and exercise. I think it's clear that the first intervention in any patient of NASH must necessarily be cut down on saturated fats, reduce your BMI, that is your weight, and exercise briskly for half an hour to 45 minutes every day. If your enzymes don't come to normal, then you get put onto drugs by your gastroenterologist, and this will definitely help prevent the complications of NASH or NAFLD.